Our articulatory anatomy includes a variety of important bones that define the face, including the mandible, our fancy word for the jaw, the maxilla, which is in the center of the face. It's the upper version of the jaw that holds the upper teeth, as well as the sides of the nose and under the eyes. The nasal bone that's at the very top of the nose. The palatine bone, which is primarily internal. Similarly, the vomer bone is part of the nasal cavity. The zygomatic bone defines the cheekbones and the side region of the eyes in the face. The mandible is U-shaped. It's fused from two separate bones in infancy. The midline fusion is referred to as the mental symphysis. On each side of the mental symphysis, there is a prominence or tubercle. Depending on the shape of the particular person's jaw, they may be more or less prominent. The main body of the mandible is referred to as the corpus. It is thicker at the bottom and thinner at the top in what's called the alveolar arch, where it holds the lower teeth within spaces called the dental alveoli. On the interior midline of the corpus of the mandible is the mylohyoid line, the attachment point for the mylohyoid muscle. The posterior part of the mandible ends at the angle, where the bone angles upward, in a spot called the ramus. The ramus goes from each side up to articulate with the skull. At the top of the ramus, there is a separation called the mandibular notch. The condylar process of the ramus of the mandible is posterior, somewhat rounded, and that makes a joint for the jaw connecting to the skull. There is also the coronoid process, which is anterior of the mandibular notch. It's a more blade-like projection where a variety of muscles attach. Thinking back to some of our earlier anatomy, the mandible looks somewhat like some of our other structures. My favorite answer here is the hyoid bone, given the U shape of the mandible and the hyoid. The hyoid also has those horns on it, kind of like the ramus. Thyroid cartilage isn't a terrible answer either, because it is also U-shaped and has some vertical projections. Arytenoid and cricoid are very different. The maxilla, or the two halves of the maxilla, the pair of maxillae, are probably the most important bone in defining the look of somebody's face. There is a frontal process on the maxilla which articulates with the frontal bone of the skull that's covered in skull anatomy and also with the nasal bones. The infraorbital margin on the maxilla is the medial and inferior border around the eye, making it part of the eye socket. There is a zygomatic process that articulates with the zygomatic bone that helps define the cheeks. There is an alveolar process that holds the upper teeth, similar to how the mandible holds the lower teeth. And the two maxillae are joined together at a joint called the anterior nasal spine. The maxilla also forms most of the hard palate. This is called the palatine process of the maxilla. The two halves of the palate are joined at the intermaxillary suture. The posterior part of the palatine process, there is a join with the palatine bone. So the palatine bone does make up part of the hard palate, but it's actually the maxilla that makes up most of the hard palate. The anterior-most part of the maxilla develops from a separate bone called the premaxilla. These fuse together at the premaxillary suture to create the entire adult palate. Looking at the maxilla from beneath in a kind of a different view, looking at just one half of the maxilla in this image, I've highlighted the premaxilla and the premaxillary suture, the intermaxillary suture between the two halves of the maxilla, the transverse palatine suture where the palate would extend to connect with the palatine bone, and then I left one not specifically abled, but a process coming off of the maxilla, that in this case is the zygomatic process connecting it to the zygomatic bone. So in this view of the maxilla, anterior is up, lateral is to the left, medial is to the right, and posterior is down. The maxilla is pretty important in our field because of cleft lip and cleft palate. These various pieces of the maxilla, if they don't fuse together properly, then we can have gaps in the face or in the palate. Classically, cleft palate occurs along the intermaxillary suture, where there's then a gap, a hole between the oral cavity and the nasal cavity. Cleft lip is usually found at the premaxillary suture, so not in the midline but off to the side, where tissues fail to fuse, and more extreme cases of cleft lip may also include cleft of the palate along that premaxillary suture, so there's an actual gap in the bone and not just skin. The nasal bones aren't particularly important. They form the bridge of the nose at the very top of the nose. They connect to the frontal bones and to the maxillae. Posteriorly, they start to connect to bones that are somewhat more inside your head, like the ethmoid bone and some of the cartilage that makes up the nasal septum. The palatine bones surround the posterior part of the nasal cavity, acting like an extension of the maxilla. The posterior part of the hard palate is the horizontal plate of the palatine bone. These are joined at the midline by the posterior nasal spine. The perpendicular plates of the palatine bone form the posterior lateral walls of the nasal cavity. Superiorly, the palatine bones come together with the orbital bone at the orbital process and the sphenoid bone at the sphenoid process, making up the upper surface of the nasal cavity, and kind of a bony plate that's in the middle of your head at the base of your skull. Here is an image of extracted palatine bones with connections to the sphenoid bone, perpendicular plates making up the side walls of the nasal cavity, horizontal plates making up the posterior part of the hard palate, and the posterior nasal spine where those come together. So in this particular image, superior is in fact located up, answer B. The horizontal plates at the base making up the nasal cavity and the perpendicular plates making up the side walls of the nasal cavity help you get that orientation. The vomer bone makes up the inferior and posterior part of the nasal septum. It's in kind of an olive green in the image shown here. It's a midline bone that helps divide the nasal cavity into two halves. Posteriorly, it connects up with the sphenoid bone and also the perpendicular plate of the ethmoid bones. Inferiorly, it connects up with the maxilla and palatine bones of the hard palate. The zygomatic bone is the bone that makes up the prominence of the cheeks. The posterior part of the eye socket is the orbital margin of the zygomatic bone. The zygomatic bone connects with a lot of other facial bones. It articulates with the maxilla. It also articulates with the temporal bone of the skull and the frontal bone of the skull. And each of those connections is a transparently named process. So the maxillary process connects to the maxilla, frontal process to the frontal bone, and temporal process to the temporal bone. The posterior part of that temporal process forms part of the zygomatic arch, which passes above the coronoid process of the jaw, and again helps define sort of the sides of the face, the cheekbone area.